I've started reading a new book. I plan to start it as a new collection here on my TikTok. It is titled, Is This Autism? A Guide for Clinicians and Everyone Else. I think this book will likely appeal to people who are unsure if they might have autism or are recently diagnosed but still kind of noticing all the ways that they might not match other autistic people. I personally find autism to be a little bit confusing in that, I conceptually understand that, the whole concept of if you've met one person with autism, you've only met one person with autism, that there are so many different ways that it can present. And at the same time, obviously not everybody has autism. And so, for me, understanding where the line is between, what is just, a different presentation of autism versus, what doesn't count as autism is very confusing to me. I remember at one point I said to my therapist, I feel like I struggle to fully wrap my head around what the core or the necessities or essentials of autism are. And of course, we rely on the DSM for diagnostic criteria here in the US, but even literally looking at the DSM, it's kind of murky to me. So this book kind of is trying to help with all of that. It goes over each specific criteria and it gives lots of different ways that it can present to try to really give a full range of experiences, including ways that it might show up differently in women or people who were socialized as girls. I have a few random passages I wanted to read from the introduction, and then it gets into the actual criteria. The problem is not that something is inherently wrong with autistics, it's that they must cope with the mismatch between their nervous system and a world that was not designed for them. This mismatch causes many problems for autistics, which can be very generally categorized as overwhelm and misunderstanding or being misunderstood. These two challenges, frequent overwhelm and miscommunication, often result in social problems and anxiety, which is what non-autistics routinely see. People with visible behavioral manifestations of autism, so they think that's what autism is, like seeing the part of the island on top of the water and thinking that the island is a flat, floating landmass with nothing underneath. However, the social problems are the result of being autistic in a world that is built for non-autistics. It is not the core of it. When we understand this, we can see why some autistic people do not look as autistic as others. The behavioral manifestations, that is, the social challenges, are the result of the autism, not the autism itself. Passage. Robinson's interpretation of the data led him to suggest that only 3 to 10% of current autistic adults are actually diagnosed as such. This book is from 2023, by the way, so it's fairly recent. This problem persists, at least in part, because so many healthcare professionals who work with adults have not been trained to recognize autism. For instance, in Osine Zerbo and colleagues' survey of almost 1,000 adult healthcare providers, most, over 86%, reported that they lacked the knowledge and skills to treat autistic adults, and many were not even aware that they had autistic patients. Undiagnosed autism is even more prevalent in clinical populations. Recent research shows that the prevalence of autism in clinical populations, especially those who have a mental health condition, is higher than the general population, often about 20% or more. As of this writing, high rates of previously undetected autism have been found in general psychiatric outpatients, as well as those with eating disorders, substance abuse, depression, and those who have passed away by self-unaliving. These studies generally found that many, if not most, adults with significant autistic traits in the population in question had never been formally identified as autistic. That an estimated 20% or more of people in clinical populations blew my mind because, that's 1 in 5. I think that general outpatient psychiatric would typically mean people who are going to a regular doctor's office for things like antidepressants, or certainly people who are in therapy. New passage. Autism cannot and should not be ruled out solely because an individual demonstrates some non-autistic behaviors. In our experience, many otherwise well-trained clinicians not only miss less obvious autistic traits, but they may also erroneously rule out autism when they observe what they consider to be non-autistic behaviors or non-autistic traits. Countless autistics have been denied diagnosis because they have typical eye contact, use basic social niceties, have friends, are socially engaging, or enjoy sarcasm. We have also encountered clinicians who rule out autism simply because an individual is happily married, a loving parent, or is successful in their career field. None of these are reasons to rule out autism. We need to do better. Having undiagnosed autism is not a rare phenomenon. Currently, data suggests that nearly 1/5 of people who present in mental health clinical settings may have autism, which may be contributing to their presenting concerns. These individuals are at a particularly high risk for co-occurring challenges, and they are regularly misunderstood, misdiagnosed, and marginalized. Recognition of their autism is central to, if not essential for, their well-being. That's the end of the intro, so I'll stop there for now and plan to do like a chapter per video. Follow me if you want to see more from this book. Again, I'll create a collection for this book.